Hello, everyone, and welcome and thank you for joining us for today's webinar on complaints, risk, and response. In the spirit of reconciliation, PracticeHub acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Thank you for joining us for the latest PracticeHub webinar. We have had yet another overwhelming response to this webinar, so clearly it's a topic of much interest, and we have a great panel with us this afternoon. On our panel this afternoon, we have Marianna Kelly. Marianna is a risk advisor for Avant, where she assists Avant members with medico-legal advice, risk assessments, and the development and implementation of risk management strategies. Marianna has a master's in risk management, which equips her to support the theory of risk management with the practical experience of developing strategies to manage the medico-legal roadblocks. Joining Marianna, we have Anna Maria Gibb, the co-creator of My Practice Manual, now PracticeHub. Anna Maria has a background in practice management and qualifications in business and adult education. I will now hand over to you, Anna Maria.
Lovely. Thanks, Katrina, and welcome everybody. As Katrina said, it's going to be a very wide-ranging topic, but the main things we'll be covering off on today are complaints management, use of open disclosure, how to document complaints, the use of complaints and risk registers, and then how to involve your practice team in handling those complaints. It is with absolute delight that I would like to hand you over now to Marianna Kelly. Thanks, Marianna.
Hi, and welcome everybody. So great to see so many people online, and particularly with all the complications we've all experienced recently with the floods, etc. And I hope all of you are doing okay with that, because we know it's been a pretty rough time. As Anna Maria and Katrina said, we're going to be talking about complaints management and some of the layers involved with this. And a complaint can have multiple pathways, and I know you'd be very familiar with the initial complaint, which can be made directly to the practice. And some of the issues around that is, was it verbally provided to the practice? Was it an online comment via Google, Facebook, or other forum? How was the patient responded to? Did it progress to the patient complaining to APRA? It could contribute to a clinical event. It could be from a family member related to a loved one who's died, and this can progress to a coroner's inquest. Or worst case scenario, could eventuate in a criminal event affecting the medical practitioner's ability to practice. These matters can cause immense stress to practitioners, practice support staff, and their family, and it's made worse due to the time it's taken, often, to reach resolutions or findings. One of the untold tolls is the significant effect these matters can have on the practitioner, the practitioner's family, and the practice manager and support staff, and sometimes that's not really taken much notice of. So hopefully none of you will have a situation like this. Unfortunately, our data shows that most medical practitioners will receive a complaint at least once to the official disciplinary bodies during their career. And so, just remember, Avant is there to help at any time with this. Do not do it on your own. Generally speaking, your best protection against criminal allegations, in fact, any allegation, is good note-taking, good documentation. You should also have a low threshold for calling for help if you experience a problem. And, it goes without saying that if you're contacted by the police about the death of a patient, always seek advice from Avant prior to engaging with the police. So why do patients complain? The basis of many patients' complaint is miscommunication. Patients may complain if something just doesn't, in their view, go right. But more specifically, if the outcome does not meet what they had in their mind was going to be the case, so it doesn't meet their expectations, they're less likely to complain about a suboptimal outcome that they were warned of and knew was a possibility. Patients may also complain about non-clinical aspects of their experience, and many of you have probably been at the receiving end of this. And they can include things like such as the fees that were charged, the amount of time they were kept waiting in the reception area, breaches of their privacy, to name but a few. And this also can be linked back to their expectations not being met in some way. And the reasons patients complain can often be that they want acknowledgement of what went wrong and to be heard, and at times an apology. And that's where the open disclosure process can be quite a positive outcome for both sides. The patient often wants to ensure that what happened to them does not happen to someone else. Unfortunately, some of them just want financial compensation, and even more unfortunately, some just want revenge, and they will be quite vexatious in how they present a complaint, and that is really, really difficult to manage. So when you're dealing with your patients, think about how do you recognise that difficult complainant, and it can be whether the content of the complaint is unclear or it's illogical. The complainant demands justice or a refund or a revisionary procedure at no cost. The complaint can include incorrect use of legal, technical or scientific terms. There is use of extensive underlining in some of the words or sentences and excessive use of capitalisation or in bold or italic text. And it also can include excessive use of punctuation in the complaint. So just be mindful when you do receive a complaint, a written complaint, just be aware of those sorts of presenting factors, because it should alert you that this one, it can be particularly difficult, and be very, very mindful how you manage it and really get assistance. So I'm going to use a brief case study to demonstrate how a complaint is managed and how it ideally should be managed by yourselves as practice managers and by the doctors involved. Now, Dr. Jones is a plastic surgeon who also performs a lot of cosmetic procedures. Now, this actually is a true case study. I've changed, obviously, the name and the specialty. So he's a really busy man. He found it difficult to manage a patient called Ms. Smith's unrealistic expectations of what she expected from the outcome of the facelift procedure. He found Mrs. Smith quite difficult to interact with, as she was so demanding and would bring photos to the consultation of what she wanted to look like. However, he went ahead and performed the facelift procedure anyway, even though he had a gut feeling that she was very difficult to manage, and not just a gut feeling, but a reality in what was going on. A few weeks after the procedure, Ms. Smith phoned the practice manager and asked to speak with Dr. Jones. The practice manager wanted to protect Dr. Jones from Ms. Smith, as she knew how difficult she was. In fact, the practice manager became a gatekeeper, which eventuated in Ms. Smith believing she wasn't being listened to and verbally complaining again to the practice manager at a second time, and complained about both the practice manager's behaviour and Dr. Jones's behaviour, and she sent a copy to Dr. Jones. Again, the practice manager and Dr. Jones ignored the complaint because they just thought she was troublesome. She then goes ahead and writes a comment on Facebook, and she also put one on Google reviews and Rate My Doctor website. She stated, "Dr. Jones claims to be so wonderful at his craft, but in fact, he made me look worse than before the procedure. He doesn't care about his patients and only cares about money. Don't let him operate on you!" Exclamation mark. So how should that initial complaint have been managed? How should Dr. Jones and his practice manager have managed that initial verbal complaint from Ms. Smith? Well, the practice manager received the verbal one in the first place. What should you do when you are trying to deal with complaints? Doctors should seek to deal with complaints about clinical care themselves, but the complaints about the practice or administrative issues should be dealt with by the practice manager. However, that should still be communicated to the doctor involved, because there could be some other layers behind it. Do not ignore verbal or written complaints. Seek to deal with the complaints as quickly as possible with an emphasis on resolving the patient's concern. And of course, seek advice from Avant if you have concerns. So some patients will make complaints verbally, but for substantial complaints, it's preferable to ask the patient to put the complaint in writing. This will better allow you to clarify the scope of the complaint, and it can be used as an agenda for any meeting with the patient. However, if a patient refuses to put something in writing, don't say it has to be in writing or we're not managing it, because that is really inappropriate. Some people may feel they don't want to put it in writing, even though it is preferable. And if you describe and explain to the patient why it's preferable, they may understand. But if they don't want to, then that's where you can get that information when you arrange a follow-up meeting with the patient, the whole open disclosure process. If you receive a complaint in writing, make sure you make initial contact by phone to acknowledge the receipt. We'd suggest that the patient is phoned within 24 to 48 hours to advise receipt of the complaint and to provide a timeline for the investigation or response. Don't be a gatekeeper for the medical practitioner, as this is a major problem that we see in Avant, which nearly always eventuates in complaints due to the patient's perception that the doctor is blocking contact and doesn't want to talk to him or her. It's really important, therefore, to have a really good complaints system and policy and procedure in place on how your practice is going to manage complaints. And Anna Maria will discuss this later relating to the hub and how that can help. And having a really firm process and policy and procedure helps the staff to understand what the protocols are, what they are to follow, and it does provide a very clear pathway of what happens next. It can ensure that the complaints are handled appropriately and in a timely manner. It should include things such as, you may have made initial contact with a patient 24, 48 hours after receiving the written complaint. Give them a timeline. When will I get back to you? Make sure you diarise that timeline. If during that time and the timeline has come, you find that you haven't had enough time to really find out everything you wanted to before you discuss it with the patient. If that's the case, get back to the patient on that date that you promised and say, we are still taking this very seriously. It's just taking us longer to investigate it, but I assure you I will keep you informed and we haven't forgotten. And it's that ongoing communication where the patient feels that they're being heard and not being dismissed. It is very appropriate also to discuss patient complaints at practice meetings and include the discussion in the minutes of those meetings. This will demonstrate that the complaint has been considered and allow for improvements in the practice to be discussed. And that's where the use of complaints registers can be really quite supportive to you in the practice. We would say don't use patient names. It's not about the patient, it's about the event. And, theoretically, it's about the event, what contributed to this event. And by having staff meetings and brainstorming what people felt contributed to the event can have a really great effect in different people's way of viewing things and enabling the practice to put improvements in to try and reduce the recurrence of such an event or such a complaint presenting. And then you should also have a column where you can monitor whether there is a repeat of that sort of a complaint. And so if it's repeated in 6 or 12 months, then you clearly know that whatever procedures and processes you've put in place to manage that has not been effective enough, and you need to go back, revisit it, monitor it, and improve it. And consider any options for improvement to your practice and let the patient know what's been done to prevent the issue that caused the complaint again. What happens next in this case study is that because, as I said, Ms. Smith felt she was ignored and she put the online social media comment on, and Dr. Jones and the practice manager are alerted to these statements on the different social media forums. Dr. Jones phones Avant to seek advice as he wants to place his own response or comment on the forums Ms. Smith posted. He was advised not to do this. He ignored the advice and the scenario got worse. And there was one comment from Dr. Jones, followed by another comment by Ms. Smith, followed by another comment from Dr. Jones. And you can imagine it went on and on and on with about 15 different comments from Dr. Jones on the social media forum. And as I said, this was a true case study. So how do you manage the use of social media and online reviews about the practice or the doctor? Many complaints and grievances come from social media posts and online reviews, as you know, and it's becoming far more common for this to occur. And it's incredibly frustrating for the practice. So one of the ways to really think about this is how is the best way to manage the negative online social media comments? We will provide some links following this webinar where we will include the Avant fact sheet on responding to negative feedback online, which outlines a range of information about negative online reviews. But I'll provide some recommendations now, which may be of assistance. So our advice is that where possible, do not respond to negative reviews, which can often cause more aggravation. Whilst it's upsetting, it's better to ignore the review and continue to monitor Google to ensure if this is a one-off comment. And the monitoring of the Google comments can alert you to recurring problems in the practice. And obviously, if there's a recurring theme, it may not be vexatious comment. It actually might be something you need to look at the practice. However, if it's a patient you can identify by the comment, it may provide you an opportunity to phone that patient and invite them to come into the practice for a meeting to discuss their concerns and say that you really value their feedback and you'd like to hear how you haven't met their expectations and what you can do to improve. And that way, quite often the patient will come in, have a discussion, and they'll remove that comment. However, if they don't remove it, there is really pretty much nothing you can do. And to go and make negative comments is fraught with danger. Most of the social media, social forum providers will not take down negative reviews. We have tried on numerous occasions, unless it's incredibly serious. And as you know, the legislation is changing on that anyway. Most of the time it can't be taken down. It's extremely difficult to conduct a defence against false statements made about you, defamation. It's incredibly difficult to do. However, if it's threatening, bullying, etc., contact Avant for assistance. Or if you're not sure what to do, just contact Avant and you'll be guided through. I often recommend to doctors and practice managers that you don't look at social media forums such as Rate My Doctor, as they can be incredibly upsetting, and some are made from people you will not be able to please. Rate My Doctor will never remove comments. They claim they don't know who is putting the comments on, and it is incredibly frustrating and incredibly upsetting for our doctors and their staff to see these comments. So particularly Rate My Doctor website, I personally believe you're better off just not looking at it. Google reviews is very different because it does allow you an opportunity to either engage with the patient, as I said, if you know who they are, or to monitor if there is a recurring theme. But along with that, if there is really aggressive comments or anything that will place your staff potentially at risk, make sure that your staff are protected with panic buttons when they're working alone. Communicate with your staff frequently and clearly. Create a culture so your people know their employer cares and they feel protected. Get your communication clear with patients as well as the general public. And in this instance, it can get very confusing and the patient can get very angry, and that's the result of what they do. Remember, at the first point of contact, people need solution and words. They need to preempt difficult situations and plan for it before it happens. And as I said, discuss it in meetings and even do role play to help educate the staff. Try and have an understanding of why patients and others become aggressive. Listen to the patient, and if unacceptable, lower your voice, and often you will see that the patient will lower their voice. Formulate a clear and concise response. Give words to the staff to use, like scripts. Role playing might have to ask a patient to step into a room in certain circumstances, and by doing a role play and it helps the staff to feel more confident if they are actually faced with this sort of situation. If there is an incident in your practice, make sure that your staff are okay and debrief. Use your website effectively, because the more consistent the messaging is on your website, the better. It sort of acts as the old practice brochure, where you've got a reference point where you can keep referring to the website and the information on your website to the patient to help them to manage expectation, but to keep referring back to, this is the way we run our practice. At Avant, and from the experience of many of our doctors, we know that if a patient leaves angry and upset, they often will complain online, or even worse, to the regulatory body. It's much better to make them feel heard and give opportunities for feedback, although we appreciate it's not always possible. So this complaint, Ms. Smith didn't feel heard, and so of course, as you would imagine, she sent the complaint to AHPRA. So how do you manage a complaint sent about your doctor or about the medical practitioner to the complaints body, such as AHPRA? The first you may know of a patient complaint is when you receive a letter from either the AHPRA investigating officer or the health complaints body, whichever is relevant in your state. And the letter will normally come with a copy of the complaint, or a notification, as they're often referred to, which will be enclosed. The complaint may have been made through a formal notification, by a letter or email, or even a telephone call. A complaint may be made by a patient, a hospital, a colleague, or on referral from the coroner following a coronial inquest, and also from Medicare. So it doesn't always come from a patient either. At the early point of receiving this complaint, it is really important that you do not contact the patient or the person who's made the complaint. This could be interpreted by the disciplinary bodies as an attempt to dissuade that person from complaining, or to encourage them to withdraw their complaint. Such a move could be considered inappropriate conduct by AHPRA. And do not contact AHPRA or the complaints entity until you've sought advice from Avant. If emotions are running high, you could say something to the person conducting the assessment, the investigating officer, that may hinder the resolution of the complaint. If you are contacted by the investigating officer, make a statement such as, I'm required according to my indemnity policy to contact Avant prior to further discussion. The investigating officers know this should be their protocol, and in fact, some recommend that the doctor does contact Avant prior to going any further. So AHPRA commenced an investigation relating to both the procedure that Dr. Jones performed and his ongoing social media comments. AHPRA's views was that the medical practitioner engaging in social media in a negative way as not complying with the medical board's good medical practice, a code of conduct for doctors in Australia. Although we are sometimes quite amazed at how many doctors are not aware of the medical board's good medical practice code of conduct. So there was a high chance with this complaint to AHPRA that Dr. Jones may receive conditions placed on his registration relating to this matter. So what often happens in Avant, and it's really good for you to know this for the future, that the Avant lawyer managing that matter referred Dr. Jones to the Avant Risk Advisory Service, which is where I work, to proactively assist Dr. Jones with this matter. So what we do is we develop a detailed education plan, which we did for him on social media, dealing with patient complaints, consent, managing patients' expectations. And he completed about 15 hours of the education, and followed by writing a detailed reflection, which demonstrated insight into what he should not have done, what he'll stop doing, or what he'll implement in his practice to reduce the chance of a further complaint relating to complaints management or managing patient expectations, consent, and use of social media. Then that completed education plan, along with his evidence of having completed it and the reflection, was sent to the Avant lawyer by us on Dr. Jones' behalf. That was included in the submission to AHPRA. And fortunately for Dr. Jones, he received a no further action from that, because AHPRA could see that he showed insight into the complaint and how he could improve his processes in the future, including not engaging on social media forums in a negative way. Sometimes our doctors will receive feedback from AHPRA stating that the member lacked insight. And this is a really difficult pill to swallow for some of our doctors when they receive this statement from AHPRA. And, what is insight, and can it vary from one person to another? And of course it can, as our mixture of our childhood experiences, our adult experiences, our culture, and our professional experience contributes to our insight. In this case study, the doctor completing the education to demonstrate he is taking the matter seriously, writing the reflection which demonstrated insight into the matter, because Dr. Jones reflected on the matter and the contributing factors, and his written reflection summarised what he'd learnt from the education relating to this matter. And as I said, he included what he would stop doing, what he would improve in the practice and implement in the future, and what he will continue to do, which supports his practice quite well in a positive way. Now, AHPRA are aware complainants can use the complaints procedure in a vexatious way. And a good example of that is when an insurance claim is underway and the medical report done by a medico-legal assessment wasn't what the patient wanted. And we see this quite often, is the patient will use that as a way to get back at the doctor. And there are so many other vexatious ways that we also see where doctors do this. What other risk management strategies can you implement to reduce the chance of a complaint? I think it is really, really difficult to actually know what issues can present. What sort of risk management strategies can you proactively put in place? Try and reduce that patient becoming unhappy. And one of the biggest things we see is managing patients' expectations. And that's not just to do with the procedure, but how you run your business, how you run your practice. But particularly when it comes to procedure, also patient selection. Do you use a psychological assessment tool if you're performing those sorts of procedures, such as bariatric or plastics or cosmetics, where a psychological assessment tool by the doctor will raise red flags for them if they feel this patient has unrealistic expectations? I am not prepared to operate on that person. And many of our doctors will use those sorts of tools, and they'll make it very clear they will not operate, or at the very least, they will refer that patient to a psychiatrist or a psychologist prior to deciding whether they will operate or not. Managing patients' expectations often is about, to discover the patient's expectation, you have to ask things such as, what were you hoping I would do for you? What do you think will happen to you as a result of what I do, what procedure I will perform? Use photos, clinical evidence-based articles, models, diagrams, other tools, and open questioning techniques. Make sure that you do document these supportive processes that you are engaging with the patient to do with consent and managing their expectations. If an unrealistic expectation is expressed or implied by the patient, respectfully correct it. If you suspect a patient's expectations can't be met, as I said, do not treat them, because it will come back to bite you. We often see our doctors who are prepared to do revisionary procedures when the patient isn't happy and they want the revisionary procedure done for nothing. That should be a red flag, an absolute red flag. And if a patient keeps wanting revisionary procedures, then you should realise as a doctor, they will never be happy, and you will almost certainly get a complaint at one point from that patient. And as I said, the consent process is so important to make sure that the patient understands what the procedure will be and what the potential outcomes will be as well. So informing consent, you are informing the patient, and the patient informs you, if you like, of what they actually want and what they think they want, which may not align. It's a two-way process, the communication between the patient, yourself, and other health professionals that may be supporting it. It involves as much listening as talking, and use non-medical, non-technical jargon. Encourage patients to ask questions and answer them as honestly as you can. Consent process and managing patients' expectation, that also involves shared decision-making. And there's some great information on YouTube about shared decision-making if you'd like to look that up. There's some great videos on this. Anna Maria will talk more probably about the consent and processes and that sort of process when she talks about the hub as well. The other issues that can present, or the other risks that will help to reduce your risk of a complaint, is the follow-up of patients. So if a patient complains, don't abandon them. Make sure that you do use the open disclosure process if something does go wrong, but also make sure you have follow-up protocols as far as test tracking, referral tracking, recalls, reminders. So that the patient is also feeling like they're actually being cared for and feel like that they're just not dismissed once the procedure's been done, the money's been paid, and it's all over. Those sorts of processes are really important to provide the patient with a sense of being cared for and ongoing contact as required. Some practices, even if it's a day surgery procedure, will get their nurse or their practice manager to phone that patient the day after to see how they're going. And that is a really good opportunity for you to find out if the patient is unhappy. They will usually voice it then. Some practices, if they've done a pretty detailed procedure, they will schedule contacts with that patient, whether it's the next day, then maybe in a week, maybe 2 weeks, etc. And again, it's that ongoing feeling of I am really supported here, but it also provides you an opportunity to ascertain if the patient is unhappy. Anna Maria will talk about the open disclosure policy, and that can be a fantastic opportunity for you to have that patient in the room with a loved one or with a relative, but make sure that the practice and the practitioner actually prepares for that open disclosure meeting in a very formal way. Don't just walk into it unprepared, because that could be disastrous. Make sure the people that are working in your practice that are providing procedures and treatments are clinically competent to do so. And that includes nurses, any allied health people. Make sure that they are not working outside of their scope of practice. Know the limits of the people that are working in your practice. And we find especially important for young doctors, because our claims evidence shows that this is an important area where doctors may come out from their their training specialty, and they're newly fellowed, and they will want to make a name for themselves, and they will often start to perform procedures that they really are not that experienced with. And that's where they will get into enormous trouble, and they don't have enough mentoring, etc. Make sure there's appropriate informed financial consent. And some of the issues that we see around informed financial consent is when a patient doesn't proceed with a booking, and some practices have said, is it okay to charge a cancellation for an appointment or for a procedure? And the answer is yes, it can be, but if you want, seek more advice from risk advisors if you're thinking of doing that. But the most important thing, if you're going to use that sort of cancellation of an appointment or a procedure, like a fee, make sure that the terms and conditions are made very, very clear to the patient before that occurs. And that's part of your informed financial consent, which should be written and verbally provided. And, the other really difficult situation is, how do you manage patients where they are demanding to be bulk billed? That's an incredibly difficult situation. And again, a lot of the information on your website, providing the patients the information prior to their appointment can be really helpful. So it's very clear to them how your practice works, what your billing procedures are, etc. The use of risk registers and complaints registers, as I said, is really invaluable to provide a robust monitoring and action process. And again, Anna Maria will talk about them in the Practice Hub. So in closing, for my part, just want to summarise: consider the factors that led to that complaint, whether there are changes that can be made to prevent a recurrence. If so, tell the patient, as they will wish to see that you have taken that complaint seriously and that you have actually made changes and that their complaint actually made a difference. Every complaint should be a learning opportunity. Use those complaints to recognise possible problems with your systems or with expectations of your patients. With every complaint, ask yourself, is there more training of staff in our practice? Is there more training that is required? How can we prevent a recurrence? What can we do to improve? Delay billing the patient or pursuing payment until the complaint has been resolved. Pursuing payment when there is a complaint can lead the patient to take the matter further. As an act of goodwill, consider not sending a bill at all until the complaint has resolved, or in some circumstances, some doctors in the end decide that they will just bulk bill the patient after that complaint has been resolved. Sometimes, despite your best efforts, the therapeutic relationship will have broken down to such an extent that you feel the relationship can no longer be sustained. There are always ways of managing this, and I refer you to our Avant fact sheet on how to end the doctor-patient relationship. And finally, for me, just make sure you look after yourselves. One study found that 95% of our doctors experience some degree of stress during the complaints process. This stress is at worst when you initially receive the complaint. It can interfere with the doctor's professional and personal life. Make sure you seek advice and support from Avant. It's really important to take care of yourself as a doctor, your staff, practice manager, etc., and seek support if you need it. And Avant has a health and wellbeing resources on our Avant website, which I think you'll find really quite helpful. And again, that was sort of me illustrating in summary how one event, one potential complaint, all the different directions it can go. So it may not just be a nuisance factor. It might just not be on social media, which is, you're worrying it's a reputational issue. It can actually go a lot further. So handling complaints is an incredibly important way of running your business. Over to you, Anna Maria.
That's fantastic, Marianna. We have had some questions come through.
Mm-hmm.
I think probably worth saying some of them are very specific scenarios. So I think probably it's beyond the scope of this webinar to go through those, but it sounds like people with very specific scenarios should probably contact Avant to talk one-on-one with either somebody from the risk team or the medico-legal advice team as well. One of the main complaints people are having at the moment is around face masks. So is there anything you would like to mention about that?
Yeah.
Where practices stand on that?
Yeah, thanks, Anna Maria. That's a really, and to people that are asking the question, because it's such a common risk advice that we're providing at the moment. First of all, look on the Avant website, and there is quite a prominent area on our website that says COVID FAQs. Our advice is that you should do a risk assessment in the practice, because you've got a duty not only to the patients, but also to your staff to keep them protected. So we recommend you do a formal risk assessment about how you're managing the potential for COVID infection, providing patients information of why mask wearing is still expected in your practice. And again, the provision of information can be really quite helpful. If the patient says, I'm not vaccinated and I don't want to wear a face mask, you still have a duty to try and provide an alternative for them to do with the consultation. And that could be via telehealth, or we will often say, is there an opportunity for you to give the last appointment of the day where no other staff members, except for one person who's protected behind a screen, and no other patients are in the room, and where that room can be used appropriately with the doctor wearing absolute protective gear and the ability for that room to be cleaned afterwards. And I know that's really hard, but you do have an obligation to, not be seen as discriminating either. So it's really quite complex.
Fantastic. Thank you for that. Marianna, I know you mentioned around in the complaints register, it's not about the person, it's about the event. Is there anything further you wanted to add about documenting the complaint?
Yes, I think that's a really good point, Anna Maria, because we still find that some of our practices will include the details of the complaint in the patient record. We would say very strongly, do not put details of how you're managing that complaint in the patient record, or even too much detail what the complaint was about. You can make a reference in patient's note, which will alert others to the fact that this person has complained, and it could be complaint received, practice manager to review, and no more detail in there. Or some people will say, use code words such as feedback received. So it alerts anybody in the practice there's a complaint at foot, but do not ever put the detail in the record, because if they get lawyers involved, or if AHPRA gets involved, they will ask for a copy of those records, and you're giving all the information about what happened here. So we would recommend that you keep the detailed information about how you are managing that complaint in a separate folder, but also document in the complaints register. And as I said, the complaints register, the purpose of that is it's not about the patient's name, it's about the event. It's brainstorming with other staff in a staff meeting to see what contributed, what can we put in place to try and prevent the recurrence, and a monitoring quantitative tool to see, has this been repeated again 6, 12 months, as I said before? And if so, then that's an indicator to you that what you've put in place is still not adequate. You need to go back and revisit it and see what else you can do.
Thank you. Just to wrap that piece up, I'm guessing maybe there's a comment there. What about scanning the document of the complaint into the record and documenting the discussions with Avant in the patient notes?
I think scanning the complaint is one thing. That may not be so bad to do, because if the patient's going to go after you, obviously the detail of why they're complaining is going to be there. But any other information related to their complaint about what you've uncovered, what you're doing, do not ever include it in the patient's record. As I said, keep it in a separate file. I've found from a risk management process, when we're working with our practices, for those that are using the PracticeHub really well, like on a daily basis, they are managing their risk incredibly well, because everything is there to help them actually keep on track with this.
Fantastic. All right. Well, on that very great note, why don't I switch over to our PracticeHub site and just show you how you can implement some of these suggestions or these points that Marianna has raised. So in this, I'm going to touch on various aspects of complaints management. So what I'll be showing you today is a couple of screens. One is how this works for someone who's an administrator, the practice manager, and then also from the perspective of your users, because it's really important, as Marianna highlighted, to get the team involved in this as well. So within our PracticeHub site, over in the practice manual, for the purposes of today, I've just bundled a lot of the policies and procedures and information into one category. But otherwise, particularly for general practitioners, our policy and procedure templates are all sort of aligned with the standards. For non-GP practices, we have a different layout, very similar content, but different layout as well. But certainly the content relating to complaints management is relevant to any type of medical or healthcare practice. So the first thing I'd like to show you is the complaints policy and procedure. Now, the way I think of this is the policy is about why you do what you do. And you can see why we're doing this. We handle them with courtesy and empathy. Again, something that Marianna has highlighted. How do we respond to feedback and those sorts of things? In terms of the procedure, we're documenting how we deal with verbal complaints, written complaints, and, certain things, contacting the patient within 2 working days. And I think it's really important, if you have all this information documented, everyone is clear about the process. So for example, in that situation in Marianna's case study where the practice manager was sort of acting as a gatekeeper, we can see that that would not align with what our policy and procedure says that we would do in the event of a complaint. We also talk about the importance of contacting the treating practitioner's medical defence organisation. So we know that that's an important aspect of managing the complaint and around documenting complaints as well. So without going into great detail into the complaints policy and procedure content, the other thing I think it's really important to note and that you can do in PracticeHub is you can link related policies and registers. So I tend to find, Marianne talked about open disclosure and all of those sorts of things. Policies and procedures don't live in a vacuum. They all are kind of interconnected. So for example, I tend to think that our complaints policy relates to risk management. It relates to management of potential medical defence, how to manage difficult patients and what to happen, actions following a significant event, and then of course, open disclosure. I'll also take you through and show you our complaints, organisation-wide risk register and our quality improvement register. And of course, as most of you know, there are different complaints entities in each state. The other thing I think is really important in your policy and procedure is to add useful resources. So similar to what we're going to be sending you, but fact sheets, articles, those sorts of things make the content of your policies and procedures much more, I think, usable to the reader, because they kind of give them a real life experience to them. There's practical advice, there's case studies, all of those sorts of things really bring those policies and procedures to life and help people understand how they need to be applied. As again, Marianna mentioned open disclosure, because I've just connected that here. We can go through and we can see here's our open disclosure policy and procedure. And of course, we've got the Avant fact sheet, how to say sorry there, and the Australian Open Disclosure Framework. So again, having these resources easily accessible, so you're not Googling them or not even possibly not aware of them, makes this much more relevant and usable for your team. In this instance, I had a bit of Marianna's example was very focused on a clinical case study, but I think I've gone through and done an example of one that maybe is more of a practice management side of things. In this instance, we've documented that we've had a complaint from a patient who's complaining about the length of time they spend on the phone waiting to get test results. And here we've documented the actions. So we've called them to apologise. And I guess in a team meeting, we've had a discussion that maybe we update our on-hold message to advise patients to contact at a quieter time, maybe between 1 and 3 is a good time. And I think I've seen this in several practices as well, as to how to manage the patients calling. And then we make sure our roster has somebody available to take those calls. So I guess from here, and Marianna, is there anything else you would add in this complaints register here?
Maybe just a monitoring process about ensuring that the scheduling of appointment times is appropriate. And what some practices do is, particularly relating to test results, is if they're waiting on it via the phone, some practices will have their nurse designate a certain time each day, and patients know, that they, as you say, that they can contact the practice between those times, and that will help to manage it. Where we do see a problem though, Anna Maria, is where front desk staff will give out test results. And, sometimes you're under pressure because of this sort of comment and this sort of complaint. It's inappropriate for that to happen. And if it does happen, because it does happen in some practices, that the receptionist only provides what the doctor notated and does not provide any other information or interpret anything else, no matter what the patient asks.
Mm-hmm. Okay. Very good, thank you. I guess too, also from the point of view of highlighting how easy this is so that, basically this is a table in here, and I can go through.
And Anna Maria, I think sometimes too, some practices have a very clear protocol that they won't provide test results over the phone.
Yep.
That you've got to make a follow-up appointment. But some patients get quite peeved at that, particularly if it's a normal result. It's a difficult one to manage.
Yes, exactly. So, but I think in terms of documenting it, we've, we've done a lot of the steps that you've talked about. So communicating with the patient and then thinking about how does this, what actions will we take based on that? And as you can see, it's a very simple process. Just, if we have another complaint, it's really just like a very simple document to edit, and you constantly have that updated. Now, if this were my practice, one of the things I would do is probably put in here something like that I want to review this register every month. And that would tie in, for example, if we held monthly staff meetings, that we would be able to go back in and look at what's in our complaints register and making sure that it prompts people to update and include the information and review it as well. So having done that, I can simply save that change, and now I'll get a notification beforehand that I need to review this. So the next step, I guess, Marianna, is, we've had this complaint. The next thought I had was, has this helped to identify any risks to the organisation? So has that complaint created a situation where maybe it's created a risk that we need to think about as well, not just handling that one complaint? And I guess, is there a potential for patients not to get their results because they didn't stay on hold, they gave up? So the changes that we made, I think, and Marianna, you're the risk expert, but very much around, this has gone from being a moderate risk, and then we've done these various steps. So we can go in and we can say, all right, having done these actions, what is the new risk, that the new level of risk as well? So I think that that's really important to think about that. In our organisation-wide risk register, I tend to break it up into business risk, clinical risk, and safety risk. Back here. So there's different things. So a safety risk would be things like a needle stick injury and so on. So again, just really thinking about, does this complaint have a greater impact beyond just one patient as well? And I think similarly with all these registers, you're looking for a trend as well. And doing a risk register, of course, helps you to determine which risks to prioritise as well.
And I think, Anna Maria, that's a really good point, because if you've got something that the likelihood of it happening is low and the consequences are low, then it will still be a risk, but it's such a low risk, you won't put a lot of resources to that. Whereas if you've got something that is high consequence and a high likelihood that it will present, then obviously that's how you prioritise the management of it. And that can be really quite useful to monitor it through these type of risk registers.
Yep, absolutely. I'll tend to use the example of, paper cuts. They're reasonably, can be high frequency, but the impact is so minimal that what are you going to do? You're not going to do away with paper to eliminate the risk of paper cuts. It's just not realistic or practical.
The other really good thing about your risk registers is that, and your complaints registers, is that this sort of documentation can actually support an investigation against the doctor or the practice, because it actually demonstrates how much effort you are going to. So don't forget, whenever you're involved with something like that, to actually use the PracticeHub to demonstrate what you have been doing.
Mm-hmm. Absolutely, absolutely. And then, of course, the last thing I think that you need to, and just for everyone's awareness, we've popped the risk matrix in here as well, because it's all about the consequence and the likelihood. So how you create that measure of risk. But then, of course, the other thing that you will want to consider is, and in the case of my example here, is what can you then add to your quality improvement register? And certainly I think, that certainly for general practice accreditation, but I think for any accreditation, there is that process around how do you manage feedback, how do you manage risk, and out of that, what quality improvements and enhancements have you made in your practice? So using, the plan, do, study, act cycle. In this instance, I've got our example here in that we've updated our on hold message, we've looked at our nursing roster, we've got a reduced number of patient complaints about their time on hold, and the number of patients receiving their results and booking follow-up appointments as required is improved. And look, you can do this for many different things. And as I say, I know for a lot of practices, you're doing so many good things, but you forget to put them in a quality improvement register. And then come time for accreditation, there's a mad rush of what have we done? But I tend to think if you build this into your process, again, you can see with this one here, I have set a monthly frequency for reviewing this register as well. Some of the other policies and procedures that I think relate to complaints, and as you saw when I had the related policies and registers, there were things like risk assessment and management, because I feel one leads to the other, the management of potential medical defence, managing patients with difficult behaviour. So you can see there, and Marianna, you mentioned sort of de-escalating with lowering your tone of voice and things like that. Documenting those sorts of things and using these policies as part of your training of your team as well. So of course, it's great to have all this content, but what happens to our users, our regular team members? How do we disseminate that information to them? So the easiest way to do that is by assigning policies and procedures to your team for them to sign off and acknowledge. So for example, if I have a look in here, this is one of my team members. What they will see when they go into the policies and procedures that have been assigned to them. So remembering this is our original complaints policy. They'll see this banner on here. You're required to read this page as part of your induction of compliance. And then down the bottom, there's a banner that says, I, whoever, have read and understood the contents and agree to comply with its provisions. So it's a really simple way for you to disseminate this information. There's no more emailing copies to everyone, circulating hard copies, counting back how many you got back from people. It's really simple. You determine which roles need to sign off. You push that notification out. This is what the user sees. They click on confirm, and now you have an audit trail of the sign-off for that policy and procedure. If you update it, you will also be able to push that back out and say, I've updated the policy, can you please reread and confirm again? And that's all done automatically in the system every time you do a save when you want to notify people.
That's another good tool to inform the patient about how serious this has been taken and the education provided.
Yes, exactly. So again, maybe in the quality improvement register, you might have put, we've updated our policy and distributed it to the team for them to read and sign off as well. So yeah, absolutely. The other thing we do, and again, this example is on our GP test sort of demonstration site, but you can also include links to other standards if you're in a different type of practice. But I think it's really important that you focus on why you do what you do, and the standards are a good way of documenting that. So I know that this relates to standard core 3.1D. So if I click on that link, it will take me to the information in the standards. Why is it important? And the other section about how to meet this criterion. So you can see that C.13.1D says our practice has a complaints resolution process. And so you are meeting that requirement as well. And conscious of time, the last thing I'll look at on here is our training modules. So within PracticeHub, we have 8 pre-configured training modules. And the one on patient communication, it includes a section around managing patient feedback, compliments and complaints. Obviously easier to manage compliments than complaints, but again, you're kind of linking your policy with the training module, which includes a quiz. So you're kind of getting evidence of people's understanding of that information. It's all well and good to sign off on the policy, but also to have that testing their knowledge as well. Makes it a lot better and more robust process, I think, for your practice. Couple of last things, next steps. If you're already a PracticeHub client, please contact our support team if you would like more information. If I've shown you something that you're not familiar with, please contact them. If you're not a PracticeHub client, please visit our website to find out the features and benefits. You can book an online demonstration with one of our team. And a one-to-one demonstration is a great way to understand how PracticeHub can help your practice. Please have a look on our website. There's other articles and webinar recordings from previous webinars, which are very useful. There's also live chat on our website that you can click on to have a chat with one of our consultants. Finally, and in closing, Marianna, can I thank you for a fantastic presentation. I'm a big fan of case studies. I just think it's so interesting to hear these real life examples and then what it means, how you can apply that knowledge as well. Thank you very much, everyone. Thank you for your time and enjoy the rest of your day.